And one thing that came up for me was, I think you don't need permission to seek help for yourself, right? So in a way, so I think South Asian women particularly are socialized that we need permission to just live.
Welcome back to the PCOS Holistic Coach podcast and YouTube channel. So excited to have another special guest for May Mental Health Awareness Month. So excited to have this conversation with Manali Deolalkar. Welcome, Manali.
Thank you.
I'll just do a brief introduction on Manali before we get into the conversation. So Manali was raised in India and she came to the US in 2017 and gained her master's in mental health counseling from Teachers College, Columbia University in New York. Manali currently holds an LPCC in California and practices in San Francisco. She works as a full-time therapist at Lyra Health and has her own part-time private practice. Manali has found herself working with women experiencing self-esteem issues, anxiety, and depression. She is passionate about working with women of color, particularly South Asian women, and is motivated to understand the cultural impact on one's mental health. A lot of her passion stems from her own identity as an Indian woman and is in the process of understanding what that identity means to her. So thanks for being here, Manali. I'm really excited to get into our conversation.
Thank you for having me here. I'm very excited to join in and just sort of discuss what this looks like in terms of mental health and PCOS and how they interact with each other.
Yeah, exactly. Because with PCOS, I know, like you said, you specifically have experience working with women with like self-esteem issues, anxiety, and depression. And that's like really common with women that also, or people that have PCOS. So we can definitely get into that. So tell us first, why did you pursue a career in psychotherapy?
Yeah, it is something that I ended up just coming across as an opportunity. I did not anticipate myself being in this career, but it came at the right time. So when I was in undergrad, I had come across a volunteering opportunity in Mumbai, which worked with folks who were having suicidal ideation and just overall distress to continue living. So this volunteering opportunity was a helpline where for individuals who were experiencing thoughts of wanting to harm themselves. And I felt really drawn to it for the first time among other internships. I was like, oh, this seems to be really interesting and similar to a lot of other South Asian households. This wasn't something that was spoken about at home, but I was in the field of psychology. So I think that field of psychology sort of like drew me towards this opportunity. And then that really opened me up. Like I remember my first interview being sort of so grounding and so just very welcoming. And I think it really spoke to me in terms of like having that space where I could share my thoughts and feelings and just kind of be myself. And even though it was an interview, it felt more of a therapy session. So I think that feeling of being listened to, of being heard, of being acknowledged, I found myself really like just as if like someone was hugging you, right? Like physically hugging you. It felt like that warmth was very much there. And then that really started bringing up these thoughts of like, oh, I would like to be there for someone else. And I just felt really like I felt like I had the skills to provide that in terms of being able to listen to other people going through a difficult time. So that is something that really started my exploration into this field. And then overall, I think my main motivation to come into the field was to support myself as well as other individuals to get to understand themselves a little bit more, to explore themselves more, to gain awareness, and simultaneously also gain awareness around things that are causing them distress and supporting that.
Yeah, that's awesome. I like how you said that, there's the resources aren't there sometimes in the South Asian culture. So I'm sure that, the people that you work with probably really appreciate the therapy that they're able to get from you. So what are some simple tips that you recommend that we can practice at home to improve our mental health in terms of like anxiety and depression?
Yeah, checking in with yourself. I think this is not something that we are used to. We are used to a very go, go, go life, right? So we're like, oh, one thing at a time, getting your next job, doing well at your workplace, having friends and relationships, all of that. So it's sort of, we're not able to pause around how we are doing ourselves. All these external things sort of determine our worth. So we're kind of focusing on that, which I think is a big part of focus, right? But I think when it comes to this question, one thing that comes to mind is just taking a few moments in your day to just check in with how you're doing, how you're feeling. And then that slowly kind of how we can get used to being more in tune with our emotions, because I think a huge part of anxiety and depression, where it comes from, is where we try to run away from our emotions. So checking in with ourselves is sort of helping us normalize that, okay, all these ups and downs in our emotions are a natural part of life, and I can give myself some space when I'm feeling sad, when I'm feeling disappointed, when I'm feeling happy, to just sit with that emotion. So that's number one. The other piece is also grounding. Sometimes we can have certain anxiety, especially, can bring up a lot of mind. We can find our mind spiraling through, or we're not able to focus on anything. We get more snappy, we get agitated, all of that, right? So when we do check in that, oh, wait a second, I am feeling anxious, and all of this is a natural part of anxiety, all these responses, taking a few moments to ground yourself. My favorite grounding exercise is pressing my feet on the ground. So that really helps to kind of be there with myself and come back into the room, because our spiraling thoughts can take us to the future or just take us away from the present. So these grounding tips, such as pressing your feet on the ground, can really bring us back into the moment. Some other ones that are also favorite ones in the field of mindfulness and psychology are sort of this 5, 4, 3, 2, 1 piece of checking in with your senses, like 5 things that you can see, 4 things that you can smell in the room, 3 things that you can taste, all of that, like just going down the senses, so that it can help.
Cool.
Yeah. So it can really help to kind of, people find this to be a good thing when they're having anxiety attacks or panic attacks, just in a grocery store or in a more crowded environment, where they can sort of come back to the room and the mind is occupied trying to figure out these 5 senses.
Wow, those are really good tips. So yeah, I think like on the first point you said, like, I think, society really normalizes things like, being busy and things like that, but doesn't normalize, getting in touch with your emotions and taking time for yourself. So I think since COVID, it's becoming like, more acceptable for people to do that. But I think, recognizing that you have to sometimes pause and take care of yourself so that you can be a better version of yourself in the other activities you do, whether, it's at work or school or with your other relationships. So that's a great point.
Mhm.
And the grounding, and I definitely didn't know about that. So is that like you have to be like barefoot, or you can wear like shoes, or how does that
Um,
work?
yeah, you can do it with your shoes too, just kind of bringing in more emphasis on your feet while they are
Hmm.
pressing on the ground. So your mind now gets shifted from thinking, being in your thoughts, to being focused on like, oh, wait a second, let me try pressing my feet on the ground. And that slowly starts to divert your mind and bring you to the present.
Okay, that's cool. Yeah, I really like that tip. I think that's a really practical takeaway for the viewers and listeners, and definitely like the 5 4 3 2 1. That's something I never heard of either. So thanks for sharing those.
Yeah. Which you mentioned earlier around like taking care of yourself. Just with these changes in your mood, or like when you're experiencing anxiety and depression at home, I think it's definitely helpful and valuable to be kind to yourself, be compassionate to yourself in your having these changes in your mood. Because when you see yourself getting sad, you then judge yourself for feeling sad. You judge yourself for like, oh, I'm not allowed to be sad. I should be grateful, etc. That then
Yeah.
spirals more into like self judgment, self criticism, etc., which impacts the anxiety a lot more. So when you do experience yourself feeling sad and finding yourself judging yourself, um, slowly bringing your attention to that compassion within yourself, thinking of how you would speak to your friend in a
Mm.
situation like this, just like that. How would you like to speak to yourself?
Yeah, that's a good point. Yeah, I really like that.
Mhm.
And I think it takes practice, right? Like you may not remember to do all of these things at the same time. And, it might take you a couple of moments to remember that, hey, I am judging myself now and I shouldn't do that. And, so yeah, I think those are some good points, and it will definitely take
Mhm.
practice. Yeah.
Developing a habit and changing a habit of how you speak to yourself.
Yeah, and I like that, like, sometimes we're really critical. I mean, I know I am critical of
Mhm.
myself, and then but like you said, you wouldn't talk to a friend that way, so why do you talk to yourself like that? Oh, that's a good point. So say that somebody is, like, implementing, all of the tips, and they still feel like they're unable to get a hold of their mental health. When should someone seek professional help? Or, like, are there signs, or what do you
Yeah.
think?
I think when you start to feel like your thoughts and emotions are taking an impact on your life, are having an impact on your life, they feel out of your control. You don't know when they come up. You just feel like you may find yourself feeling sad without knowing where it's coming from, or your emotions are constantly fluctuating and they're impacting your work, they're impacting your
Mm,
relationships, they're impacting your relationship with yourself. um, all of these good can be some like cues of
mm,
seeking support. Because and that support doesn't necessarily have to be therapeutic, right? But it can also be like social support, or just checking in with someone that like, this, I am going through a difficult time. Because when we are going through anxiety, depression, or just even without naming it, right, even if we are going through these constant fluctuations in emotions that just feel overwhelming and not something that we are able to hold have a which are controlling us, as versus to be feeling like we have any say or agency in it. We may also find ourselves isolating ourselves, and we
mm.
don't seek support from it becomes even more difficult to share things with others, share how we are feeling with others. But that can be a good time to maybe check in with a friend or check in with professional support, to share how you're doing, what you're going through,
Yeah, that brings me to the next point. I know we touched on this a little bit, but how can someone do like seek support despite the stigma, especially in the South Asian community, and without maybe support from family or like a partner? If Yeah, go ahead.
Good question, and also a challenging one, right? Like it definitely hits home, and it's not. I really wish there was, this question didn't have to exist, right? Like I really wish there was that openness for you to feel comfortable going to your family and friends or really partners. But I think the first piece is acknowledging what you're going through is valid and needs support. I think that is a piece that we often find difficult within South Asian communities because of this like societal shame around mental health, right? And societal shame around like you going and talking to a stranger about what you're going through. Now that societal shame, that family shame starts to get internalized within us. So
Mhm.
now our maybe our family doesn't think we need help, or family thinks that, or like whole stigma around mental health, and we ourselves start to feel like, oh, is it even valid for me to seek support?
Mhm.
So I think that is one
Mhm.
piece of like recognizing that internalized shame and internalized stigma that you're going through, and you may not completely let that go before seeking help, right? That stigma may still be coming up, that shame may still be coming up, but what therapy can do is help you um, firstly normalize what you're going through is natural, and what you're going through deserves the space you need, and also not normalize the shame that you're feeling around coming in for mental health based on the cultural factors. So I think all of it can really help you give the space you need to take care of yourself. um, and one thing that came up for me was, I think you don't need permission to seek help for yourself, right?
Oh,
So
that's a
in
good
a
point.
way,
I like that.
um,
Mhm.
so I think South Asian women particularly are socialized that we need permission to just live in some way, and permission to keep doing things. So we may find ourselves not being able to give ourselves the permission when it comes to supporting ourselves, or when it comes to seeking help. Um, so that is one part of it, right? About how the societal shame has internalized, has led to you being able to seek help, seek support, and working through those personal beliefs about what you think mental health is and all of that. And the other piece is, I think, a big one is, if you do decide, if you give yourself permission that, wait a second, I can seek help, I think it's valid for me to seek help at this point, I want to go ahead and do so, you can either check in with a friend, or a trusted family member if you feel that would be helpful before you can take the step to seek therapy,
Mhm.
but going with someone who you feel safe with, right? So that is one piece. If you don't have someone who you could feel safe with, um, check seeing if you can go at least for 1 or 2 sessions in therapy, even though it's completely out of your comfort zone. I think that first or second session can help you, um, again, not feel isolated in making this decision. And slowly, there have been people who have found it easier to tell their family members after a couple of
Mhm.
sessions, when they start to feel more confident in the fact that they are seeking help for their mental health. When they start
Right.
to give themselves the permission to do that, they're able to open up with their family members a little bit more, and also not sort of let it, not from a place of permission, but more from a place of like, I would like them to know this piece of me.
Yeah, that's a lot of great information. And I think, you pointed out tips on, realistic obstacles that people may face when trying to seek therapy. And I love what you said that, you don't need permission to seek help for yourself. And I definitely agree that, especially South Asian women, we in our culture or just our upbringing, we're kind of taught, or I don't know, I guess just had the upbringing where we may not even realize that we're asking for permission, but I think
Correct.
subconsciously we feel like we need to get permission, whether it's from,
Mm-hmm.
family or a spouse, right? And
Mm-hmm.
I think
Yeah.
some of it may happen subconsciously, we don't even know it.
Yeah. And in that process of therapy feels like, okay, that's too big of a bold of a step to go ahead and give this to myself. I think checking in with a trusted friend or a
Mhm.
trusted um, family member can really help um, validate that, like, oh, what you're thinking is valid and what you're feeling is valid, and seeking therapy is not going to make you um, any of those negative words, right? Like, it's not going to make you crazy or like, um,
Yes.
Mhm.
Yeah, and I think like what I also tell like a lot of my clients with PCOS is like, listening to your own body and your gut. Like if your gut is
Mhm.
telling you that, hey, I want to seek help outside of what I'm already trying to do to help myself and it's not enough. I think
Right.
that's what like you were saying as well. Like, you don't need permission from anyone else to seek help, and kind of like listening to yourself. Like if you feel like you need more, then trying to find that, whether it is with the support of family and a significant other or without.
Right. Yeah. Yeah. And there have been people who have practiced in therapy how to tell this to their family, to their parents, that they are seeking therapy. So that is also something that therapy can support you with. And again, not just promoting therapy here, but like other
Yeah.
forms of support can support you with. Again, going back to that piece of, you don't have to do this yourself, right? And seeking support
Hmm.
in bringing this up with your family is natural, is important, and is very valid.
Yeah, and I think, one of the questions I had, but you already answered it, is like, how can someone navigate this if their family says, don't talk about your problems outside of the household, or, if they get dismissed, like, oh, why do you even need to seek therapy? But I think we covered those points. And like you said, it's not just therapy, but also like medication. If somebody needs
Mhm.
medication for whether it is anxiety or depression or anything else,
Right.
right?
Yeah, yeah, completely. Yeah. I think a big part of it, I was also that came up for me was minors, especially who, or people who are financially dependent on their parents, right?
Mm-hmm.
To provide, to pay for therapy, or just pay in general. And I think that can be a tricky piece as well. And um, on that front, I think with minors, with especially in the US, I think in schools there are free school therapeutic resources that you
Mm-hmm.
can, and they are confidential, and but they, but I think they also make a judgment on whether it's safe to bring in your parents or not, because parents have to give consent to seeking therapy. So it can be sort of multi-layered, because there are some times when consent is required, but there are some times when, based on whether it's safe to bring in the parents or
Yeah.
not, the therapist makes that decision. um, but I think overall, on a more like advocacy level, I think it's important for there to be resources where therapy can be accessed, especially for people who are experiencing either financial difficulty or just not being able to speak with their parents to bring in those financial resources to pay for therapy, right? So it would be nice to have systems and resources in place for supporting people, so that they don't have to initially disclose to their parents, just so that
Right.
they can um, get the resources to pay for it.
Yeah, I think that's a good point, looking for resources, free resources in schools to get started. And then I know like there's apps that can help you or connect you with
Mm-hmm.
therapists. And then
Right.
there's also options for like students to pay like lower fees if they don't want it, if they have to pay themselves, if they don't have the parents' support yet.
Yeah, completely.
So my next question, we touched on this a little bit, but many people with PCOS have unpleasant symptoms like, weight gain, hair loss, unwanted hair growth, acne. All of those things can lead to low self-esteem. So what are strategies that you can recommend to help us deal with improving our self-esteem?
Yeah. One thing is how much our value of being a um, how much the society's value of being a woman is tied to your beauty or tied to like being more feminine, etc. Right? And like sometimes, and how PCOS can really start to attack that and like the societal idea of what beauty is. And I think that's really for someone who may be experiencing certain insecurities and low self-esteem about themselves. When you add PCOS on top of that, it starts to get even more highlighted and internalized. And similarly, if someone is, say, experiencing PCOS from a very young age, that's becoming a part of your identity, right? So I think recognizing how PCOS is impacting your self-worth, your self-esteem is, I think can be a first step in kind of making that connection. Once we make that connection, we can slowly challenge that, right? Like, this is what society thinks I should look like, but I would like to look like XYZ, or this doesn't mean that I am unlovable, or this doesn't mean that I am not worthy of what I'm worthy of. So kind of how like PCOS can really impact one's self-esteem and one's self-worth in that sense. So sort of recognizing that, again, not by yourself, but like with support. I think a big piece is, as I think one of your videos you had mentioned, it's not something you've that's spoken about as much, and the community is not as vast. So one may think having PCOS is a personal failure, as versus to like this is something that's extremely common and so many women go through, right? So what you're feeling is very natural and valid, and a lot of other women who experience this also face similar mental health issues or self-esteem difficulties. So I think it would be nice to, I think one piece that comes up is connecting with people who may have a PCOS, or being a part of a community, maybe some support groups where what you're feeling can be validated, and also you recognize that you're not alone in feeling lower self-esteem, or feeling like, oh, you have more support around you who can validate that.
Yeah, I like that. So you were saying basically like if you do seek help, recognizing that, what society expects you, how society expects you to look, and their definition of beautiful versus like what your definition of beautiful is, or just in general of the type of person you want to be, and, connecting with others that also understand how you're feeling. Yeah, I think those are great tips. What is some new research that is in mental health that you could share with us?
Big pieces within the mindfulness idea of like how our mind and body interacts with each other. So especially in the form of mental PCOS, I think research the research is not related to PCOS, but how our changes in our body can impact our mood, can have an impact on how we feel. And similarly, when we feel a certain way, right? Like when we say we feel anxiety, checking in, we can feel that within our body. We can feel that, like we can feel our heart pumping, we can feel our stomach being really tight, things like that. So kind of paying attention to how is your mind interacting with your body and how is your body interacting with your mind. This sort of connection has been helpful with coping, where say anxiety, you're experiencing anxiety, you heard your heart pounding, sort of doing breathing exercises or just checking in with your body, being there with it, to help sort of cope with that feeling. And similarly, the other way around, like how our hormonal changes within our body impact our mind, that can really help us self-validate that, like, oh, my body is going through a difficult time, no wonder I'm feeling this way, right? So it can really help you sort of be compassionate both with your body as well as your mind.
Yeah, so it sounds like a lot of the things that we're experiencing, there's kind of research to prove or validate those feelings that, we as women probably have been experiencing or feeling for a while, but may not have made the connection. And, we are more intuitive. But I think it's good to know that that research is there and, the strategies of how we can deal with those feelings of anxiety and the hormonal imbalances and things like that. So that's good. So are there resources that you recommend that we can learn from more about like our mental health or improving our self-esteem?
The book that really was very helpful was Maybe You Should Talk to Someone. I think I really like that book to sort of get an understanding of what therapy is and how, and I think the author is a therapist who talks about their experience of being in therapy on the other side. So as a client, so that was a really good one. There are some podcasts as well. I think one of them is I'm Stuck, Not Broken. I think that's a good one. It again helps us validate this piece of like, you don't need to be fixed, and nothing what you're experiencing does not mean that you're broken. It just means that you're stuck, and all of us get stuck from time to time. So kind of helping us, it brings up different stories of that, so that can also be a good validating piece.
Yeah, I love like a lot of the things you said like today, that like you don't need to seek permission from anyone to get help. And just because you go to therapy, it's not to fix yourself because we're not broken. It's just who we are, right? Yes, I love that. I love that. Is there a way for viewers or listeners to work with you? Are you accepting new patients?
I am accepting new patients, and if someone would like to connect, they can reach out through my Instagram profile, which is at Spiral Up Therapy, or they can email me at spiraluptherapy@gmail.com. And the only caveat to that is I am only licensed in California. So if you would like to connect, you would have to be physically located in California.
Okay, great. But if you were in San Francisco, but are there virtual appointments for people if they're outside of San Francisco, but in California?
Yeah, I only do virtual appointments. So
okay, great.
yeah, so we'll be meeting over Zoom.
Okay, awesome. Well, thank you so much for taking the time today, Manali, to have this awesome conversation. I think is very insightful, and you shared some amazing tips. Was there anything else? I don't know if you had anything else to mention before we finish up.
No, I'm really glad I was here. I'm really glad we connected. I think it's definitely an important topic, but also really important topic of like how PCOS and self-esteem and mental health can really impact each other. And I really appreciate, and it's very inspiring to hear that you're spreading awareness about something that's so commonly experienced by women across the world. So I'm really thankful that you're here and you have the space where you're sharing your thoughts.
Well, thank you. And I think you gave a lot of practical tips that, people can implement starting right now, once they finish listening. So thank you so much. I'm so happy we connected as well. As always, everyone, be kind to yourself, be patient, and focus on progress, not perfection. I'll see you next time.